SANIBONANI, MOLWENI, hello, Unjani. How are you? Are you okay? So, welcome to Family Planning. I've been so excited for this series. It's been a long time planning. So I'm so excited. Today we have Sr Daleen Goosen, who's going to speak to us about family planning and what that means and what it entails. So they'll be speaking about the injectables, the oral contraceptives, the condoms and the different kinds of condoms, and also what they do to your body. Some of the side effects are discussed here. Not all of them. We'll have that in a later video. Like my friend over here who says hi to everybody, one of the side effects of oral or the injectables may just be acne. So should you have any questions regarding family planning, do send them our way. The next episode should deal with a lot of the questions. And maybe we'll talk more about the side effects and also other STDs and SDIs. If you have any questions relating to what was said here today, do send them my way. You know what to do, right? My name is Keisha Lee, and I'm your host for Take It All.
Hi everybody, I'm Sr Goosen. I'm a registered professional nurse. I work in primary health care where I do everything from family planning, STIs, child health, TB, and child curative. Currently I am doing family planning, which I present to you today, and we're going to talk a little bit about different family planning methods you get. We're going to talk about what does the family planning do, why do we take it. So firstly, I want to show you something. This is your womb, righto? So what happens every month is when we get our menstruation cycle, a little egg. Can you see the little egg? Yeah, there we go. This is the inside of your womb. Here's a little lining in here, the endometrium. This is your cervix. This is your vagina, your vajayjay. Okay? So, what happens every month is this egg is released. It goes down there, this is your fallopian tube. Goes out, round and round and round. It comes and it goes and sits there. So every month when it's your menstruation cycle and your time to menstruate, this endometrium thickens. It prepares itself for a baby, for the egg to be fertilized. When a fertilized egg gets to the uterus, so it gets ready for implantation. So this little eggy comes out. It's fertilized. Remember, it's fertilized. You're not on any contraceptive method. It comes out, swims right around, right. Okay, you can see that red part, that endometrium. That egg comes and it attaches itself there. That is when conception starts. You are pregnant. Yes, you are pregnant. So, when you're on a contraceptive method, this endometrium doesn't form. It doesn't form. So, when that little fertilized egg comes out, there's nothing to attach itself to. So, that is when your menstruation comes in. So, that little fertilized egg with the endometrium, can you see? It sheds itself. And then you bleed and it comes out through the cervix, through your vagina, and it's called menstruation. Okay? Righto. So, when we use contraceptive methods, this endometrium doesn't form. So this bleeding doesn't happen. Okay? So let's go over to the contraceptive methods. Righto. This is my little friend. Can you see? This is my little friend. All the contraceptive methods. Okay? So firstly, I'm going to talk to you about these two. These are our injectables. Okay? These two we inject into your butt at the back, left or right butt. This one is Depo-Provera or Petagen. You get two types. This one we give every 12 weeks. Okay? This one is the Nuristerate. This one we give every 8 weeks. So basically every 3 months, every 2 months. These two only consist of one hormone. Okay? These injectables have the minimal side effects. Okay? Side effects you will get is your period will go away. You won't get a period at all. Some people experience abnormal bleeding. Abnormal bleeding is when you will bleed for more than 2 weeks on one. Okay? That is abnormal bleeding. Some people will experience a lot of pimples, acne in their faces. Okay? Some people, unfortunately, will gain a little bit more weight gain. So you will get a little bit fat and more sexier, like me. And some people at the beginning, when you start on the contraception, will be a little bit moody. But all the side effects do subside within 6 months, because it takes 6 months for these two for your body to get used to it and for your body to adapt to it. So these side effects I mentioned now will happen not for everybody, only a few. Some people walk away with nothing. So only some people experience these side effects. Okay, and I know some of you will love your period to stay away. And I know some of you use this for your period to stay away. We don't have a problem with it, but don't use it for period staying away, because it is a contraceptive method. Okay. Recently we have had a lot of people coming to the clinic complaining that this little bugger here is giving them a low sex drive. Guys, it can happen. It can happen, but it's not a lost cause. All you have to do is come talk to us. We can correct it. Okay? So don't go off it and now go and get pregnant. We can help you, but it happens very, very little. It's like 1 to 2% of cases. Okay? Okay, so our little injectables there gets injected, as I said, with a syringe, as I said, into either buttocks, whatever you choose. So it will be either every 2 months or every 3 months. Okay, what the injectable does is it prevents the endometrium from thickening and getting ready for a baby to be implanted, so you can't get pregnant. because there's no endometrium, there is no blood. So some people always ask, where is the blood going to? The blood is going nowhere because there's no blood to shed. Okay, because the injectable prevents the endometrium from forming. So there's no blood. Okay, right, that's the injectables. Then I'm going to move right over to this little one. This is what the Implanon looks like. It's big like a little matchstick. Okay, the Implanon, we put it into your arm with a little we call it a receptor. We put it into your arm. The non-dominant, say like if you're right-handed, we will put it into your left arm. We put it right here on the upper arm. We'll put it in here with the applicator. Okay, don't be scared. We localize it. We'll put it, inject it with a little lignocaine until it's dead there, until you can't feel anything, and then we will put it in. Okay, the Implanon will stay there for 3 years. Okay, so now you know, for 3 years you don't have to worry about coming to the clinic every time, because it will be there for 3 years, no problem. You don't have to worry about it, it's in. Okay, the side effects for the Implanon is more or less the same as the injectables. That's why I went straight over to that. So because the same hormone that's in the 2 months and the 3 month injectable is the same hormone that's in the Implanon. It's just the Implanon is implanted into your arm and it will be there for 3 years. So the side effects is the same. But now, we in the healthcare system have a problem, because people out there are making up their own stories, believing their own thing, telling stories about what this Implanon is doing. The Implanon is going to do this to you, the Implanon is going to do that to you, and now people come and they just have this thing in a month or 2 and they want to remove it. Okay, which is becoming a big problem in our facilities and our healthcare system. The Implanon is exactly the same as the injection, exactly the same. And the people are telling the people, your hair is going to fall out, oh, you're going to lose weight, you're going to get pregnant through it, or things like you're going to lose your baby if you get pregnant with it. You won't be able to get a baby with it, after you've removed the Implanon. You won't be able to get pregnant, stuff like that. And it's not true, because what counts for the injections, the injectable contraceptive method counts for the Implanon. So whatever side effects you're going to experience there, you will experience it there. And again, if you should experience any side effects, it will go away after 6 months. It will only be there for about 6 months for your body to adapt to it. So like any other contraceptive, they do have side effects, but it will go away. Some people don't get any side effects at all and are so happy with the Implanon, because they put it in, it stays there for 3 years, and then they don't have to worry about anything. Okay, the next thing we have is what they call the loop. There we go, the loop, or the Iucd, which stands for intrauterine contraceptive device. Okay, this is the copper one. This is a little copper there. Okay, it is inserted with a little applicator up here with the applicator through your cervix inside. So let me just show you. There, it goes up and it sits there. Okay, there. So what this copper on the loop does is, it's unfavorable for your uterus, and it's seen as a foreign object. Any foreign object in your uterus won't make your uterus favorable for implantation of a embryo. So you can't fall pregnant. Okay. You can't get pregnant with the intrauterine device in your uterus. One of the side effects that most of the women complain of the intrauterine device is heavy bleeding. And it's quite painful. You can get a very heavy bleed, and it's very painful, but it can subside between 3 to 6 months as well. But then the intrauterine device you can keep in for 10 years. For 10 whole years you can have it in your uterus, and then after 10 years we will remove it. So you know you will be covered at least for 10 years. Okay. It's very common amongst older ladies because they prefer it, because they see it as a longer period that they will have it in, whereas the younger couples that are planning maybe children apart every 3 years, every 4 years, it won't be suitable for them. Okay. Then the other thing is, when you remove the Iucd and the loop today, tomorrow you can get pregnant. Okay. I forgot to tell you, the injectable can take up to 9 months, up to a year. If you stop using it today, 9 months to a year to totally get out of your body, and then you can only get pregnant. So if you're planning to get pregnant, say you want to get pregnant, it's now November, you want to be pregnant now, it's not going to work. You will have to wait till next year. Say from June, September, you will only fall pregnant if you leave it today. Okay, so the injectables is one of the contraceptions where it's going to take longer to fall pregnant. Okay, the Implanon, although it's very similar to the injectables, you can also take it out today and tomorrow you can be pregnant. Okay, right, so now we're going to go over to our oral contraceptives, and we have a huge variety. There you can see Microval, Triphasal, Oralcon, High-End. Okay, quite a few. Oral contraceptives, the injectables and the Implanon have one hormone. Oral contraceptives have 2 hormones. Okay, so the High-End, this one here, and then we get another one. It's not on here now, but it's feminine, but it's not widely used. But High-End is the only oral contraceptive with 1 hormone. Why? Because we get women that don't want the injectable, and then they prefer the contraceptive, but they because of health reasons and certain issues, they're not allowed to take 2 combination pills. So now we give them High-End, which is a 1 hormone contraceptive pill. This pill we only give to breastfeeding mothers, that are women that are chronic hypertensive patients. Okay, so High-End we're going to give to people that has hypertension, high blood, and breastfeeding mothers. Okay, then if you're not breastfeeding anymore and you are choosing that you want an oral contraceptive, then we have Oralcon and Triphasal for you. Okay, these 2. Microval is the same as High-End, it's just different brand names. Okay, So oral con and triphasal is going to be your choice of oral contraceptives. Okay. As you can see, oral con has 2 colors. Triphasal has 3 colors. Actually 4. Red, what is this? Orange, white and brown. Okay. The oral contraceptives, you have to take 1 every day, the same time. You are not allowed to skip. Oral contraceptives regulate your reproductive system, your menstrual cycle. So if you should forget it, one day, tomorrow you can be pregnant. Okay. The other thing is you are not allowed, let's put it this way. If you are sick, you're going to the doctor, you should always tell the doctor you're on an oral contraceptive, because antibiotics and certain medications can interfere with oral contraceptives efficiency. And although you're taking your contraceptive every day, the oral contraceptive every day, the same time, and you're taking other medication as well as antibiotics, you can fall pregnant. You can fall pregnant. If you are a heavy drinker and you smoke, you can become pregnant through the oral contraceptive. So your oral contraceptive you should take very, very holy. Please, 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 please. Going to the doctor, tell your doctor you're on the oral contraceptive, because while taking the medication or antibiotics, you're going to be unsafe, and you will have to condomize as well, because you're going to be unsafe. Okay. Then, side effects with our oral contraceptives will be breast tenderness, abnormal bleeding, nausea, but normally it resides very quickly. You can get headaches, moodiness, and visual disturbances. One of the things with oral contraceptives that we watch is your blood pressure. Okay, oral contraceptives has a way of increasing your blood pressure. So every time you're going to come to the clinic, we have to take your blood pressure to see if it's okay. Okay, righto. So this is your baby. Lots. The choice is yours. It's wide open. Do you want an injectable that you will get every 8 weeks or 12 weeks, 3 months or 2 months? Do you want a Iucd or loop inserted into your womb, which will be there for 10 years? Do you want the Implanon into your arm, which will stay there for 3 years? Do you want the oral contraceptive, which you will take every day, the same time? Don't forget it, you're going to get pregnant. Please, 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 please. You mustn't be a smoker and a heavy drinker. Okay? So the choice is yours. Then all of us know this little babies here. Our condoms. The male condom, female condom. We know them. Okay? So, condoms, we do, it is a contraceptive method, but we do not advise it as the only contraceptive method. Okay? We will rather say, go on one of these, use this as dual protection. Because what do condoms do? They also provide protection against STIs. and HIV/AIDS. Okay. We have a female condom and a male condom, so you don't have an excuse. If the guy doesn't want to wear a condom, you wear the condom. Here we go. You wear the condom. There's one for you too. So if he says no, you can wear it. And what's so nice about this condom, you can put it an hour before into your vagina. So when the time comes, you're hot, horny, wet, you have it in. No struggle of disturbing the romance and the you know what. You have it in. So all he can do and what you can do is just enjoy it. After sex, you just remove it. Put it into a piece of paper, towel paper, and dispose in the dirt bin. Not the toilet, the dirt bin. So nice. Let's have a look what it looks like inside. They've made it so nice nowadays. Look. This is the little ring. This ring stays outside. This little sponge, don't be scared when you see it. Okay. Remember, this can save your life. Because it can save your life from an STI. It can save you from HIV. Please, people, condomize. Please, 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 please. Okay, I'm going to show you how to use it. You do this. You take little spongy. Look at my vajayjay. Say hi. Hello. Here we have our little vajayjay. And you put it in. Squeeze it right in. Put it in. You use your fingers. Okay. In and squeeze. Put it in. In. The sponge helps it to keep in place. Okay, because I know you get female condoms that don't have the sponge in. But what's so wonderful about the sponge is it keeps it inside. And you know what? It gives extra pleasure. I didn't say so. Anyway, and there you go. There you go. Nicely outside vagina. Then he can come. There he comes. There he comes. There he comes. Look. How nice. No problem at all. Afterwards, out. You turn it around. Take it out. Here it comes. And all the semen that was ejaculated will sunk into the sponge. So no leaking out of here. How great is that? Look, and then what you do is you just take it, you make a knot. There you go. All the fish's sperm, semen is in there. Put it in a little paper. You can even put it back in here. Dispose in the bin. Finish. And why I love this female condom is you can put it in an hour before having sexual relations. So nice. A male condom must have been there all the time. Ooh, hands are sticky now. Yes, we can do that. It's only the outside packet. My hands are sticky because of that female condom now. Okay. Righto. This is my penis. Say hi to my wooden penis. Righto. This is how we do it. What smells nice? Banana flavor. Oh, I love it. It's nice. You can do oral sex with it too. Right, so we're going to pinch the tip of the condom. Right, so there. You see? You see? Tip. There must be space for the semen to collect. Okay? Keep it. There we go. Look, look, look. Down. There. Where's my JJ? There she is. He will come. In he goes. Finish. Takes. You keep it there. Okay, never just pull out. Right, you keep there, pull out. There, you see? All the semen will be in there. Right, so now we roll the door. There we go. Keeps it. Right, everything is there. You don't do it, he must do it. If you want to, you can do it. There, everything is here at the bottom. Also, in the paper, in the bin. There you go. Easy as that. They come in nice grape. They come in banana. They come in vanilla. All the flavors. They smell so nice, you even want to give a blowjob. Yeah. So, please, guys, STIs and HIV is real. Please condomize. Use dual protection. Although you are on a contraceptive method, also use a condom. I have had personally guys, women, girls come to me. They're in stable relationships and the one or the other, they've got STIs because the other partner slept around. Some of them came, they have HIV. It is a reality, guys. It's a reality and our stats are high. So please use dual protection. If you are not married, dual protection. If you are married and planning a baby, go off your contraceptive method. First go for an HIV test, make sure everything is fine, and then you and your husband decide to have a baby and you do your thing and have the baby. One of the questions that was asked to me is, what is the difference between an STI and an STD? STI and STD is the same thing. The only thing that happened was, in the olden days, it was called STD, which is sexually transmitted disease. But then the World Health Organization came in and said it's not a disease. It is an infection that is that you get when having unprotected sex. It's not a disease, it's only an infection. So they changed the name and it's actually not called STD anymore. We call it an STI, which is a sexually transmitted infection. Okay, so no more we should actually talk about an STD. Oh, Monique, please, Katlego didn't give you an STD, it's an STI, and I thank you. So it's a sexually transmitted infection, not an STD anymore, because it's not a disease, it is an infection. Okay, so if you don't want that infection, you don't want HIV, use my little friends, yeah, use them. Use them, please, guys, use them, especially the young people, the youngsters. Please use them. Use them. I see 14-year-olds, 15-year-olds, 16-year-olds getting STIs and HIV infection. Please, it's a reality. I see it every day. Then, if you're single or in a stable relationship, you're not married, Here's your Smarties. Here's your Smarties. Use them. Don't let anything stand in your way of having nice, favorable, hot sex. Don't let unwanted pregnancies spoil the flame and the romance. Wait until you're married. Plan your baby. There we go. Decide what you want to have. Here we go. So, interesting. If you want to know anything, you can pop me a question and I will answer you. Anything you want to know? Oh yes, one thing I forgot. How can I forget the main thing? Oh, sorry, forgive me, please forgive me. If by any means this emergency happens to you, I hope not and I pray not it doesn't. If you have sex with only a condom, you are nothing, no family planning. Condom breaks. Or if you have sex without a condom, nothing. And like we will say, he comes in you, you think you get pregnant now. Please guys, normally first it was within the 72 hours and we give you a tablet and the next morning we give you another tablet. Okay, but now it doesn't work like that anymore. Okay, it changed. But please, there is also a thing called emergency contraception. You come to the clinic as soon as possible. Within the 5 days you come to the clinic, we will give you a stat 1 dose emergency contraceptive. Okay, and what we always advise you, if you come too late and we give it to you, come again so that we can see if you're pregnant. So there is emergency contraception available, but you must come, please guys, please. If it happened tonight, come tomorrow morning. Please come tomorrow morning. Don't wait for next week because then it's too late. Okay, it's only 1 pill you're gonna take, finish. In the past it was like take 1 now, come out and again in the morning. Now we give you 1 tablet. Okay, then don't make it a habit. After that, if that emergency happened, go on permanent family planning, because doing this, if you're going to use that as a contraceptive method by having unprotected sex every time and this happening to you every time, and you're coming for emergency contraceptive like say every month, my dear, your chances of getting a child is going to be minimal. You're messing your reproductive system up. Okay, so one day when you get married, you're going to wonder, why can't I conceive? Why can't I get pregnant? It's because of what you did. Your indecisive decisions, you didn't want to go on a permanent method. Every time something happened, you just want to go on emergency contraception. It doesn't work like that. You're messing up your reproductive system. The other thing is chopping and changing between contraceptive methods. You're messing up your reproductive system. Okay, and never ever change on by yourself. Say for instance, you on the tablet. Don't just stop. Go to the clinic that you got the tablet and tell them, this is my problem, this is what I'm experiencing. We are there to help you. Don't do your own thing. Because at the end of the day, you're messing up your body, your reproductive system and your future. And you will wonder when you're married or whatever, you will think, why can't I get a child? Why is it taking so long? It's because of the decisions you made in your past when you were younger or when you were not married. Please help us to help you. If you have a bleeding problem, if you have any problem, come to us so that we can help you. Don't do stuff on your own. Please. Things we get at the clinic. Let me just make an example. This lady had an Implanon in her arm. She came to the clinic. She took a tablet on top of that. She goes to her other clinic, she takes an injection on top of that. Now, what does that do to her reproductive system? We are there to help you. Come talk to us if you have a problem. Anything you want to know, we will help you. If this one method doesn't work for you, we'll help you to get another method. But talk to us. Let us help you. Don't do your own thing. Please, you're going to mess up your own body and you're going to mess up your own future. Okay? So, that is my little cream on the cherry on the pudding this afternoon for you. I hope the information will help. What I don't like to talk about is the last resort. If you have an unplanned pregnancy because you're not using family planning, you're going to be pregnant. Now you're sitting with an unplanned pregnancy that you don't want. What to do next? That is called abortion or adoption. Okay. Very sad part to talk about, but that is your next options. I'm not here to judge you. I'm not here to tell you what to do. But if you did this in the first place, you wouldn't sit with that problem. But if we come to that problem where you sit with an unplanned pregnancy, come to us. We can talk. We can counsel you. But as I said, the only two options for you is abortion or adoption. Or keep the baby. Keep your little baby. But it's up to you. I can't tell you what to do. I can't. It's all up to you. It's for you to decide. It's your body what you want to do. I can't tell you. But guys, it has been nice talking to you. I hope everything I told you will be helpful and that it will be of use for you, and that you will take it in and make it a good decision on what you're going to use for family planning. And then lastly, enjoy sex. Don't let things like, oh, I'm not on something, oh, you must pull out, rob you from having your best sex. Don't let, oh, I'm so scared I'm going to get an infection, rob you from enjoying sex. Use a condom. Go on family planning. Don't let anything stop you from having your best sex ever. Please, guys, enjoy. Nice meeting you. Bye.